All right, so we're going to do a presentation tonight called COVID-19. It's the basics about how to keep yourself and your family safe. My name is Dr. Valda Crowder, and I'm an emergency medicine physician. I've been an emergency medicine physician now for 30 years. I also, through a company called Capital Health Partners, provide expert medical review for all the medical malpractice cases that come out of the Virgin Islands for their Attorney General's office. I have my contact information down there, and we're going to try to go through this I'm going to kind of go over what the basic structure is. Some new information, and the presentation does change from week to week slightly based upon some of the questions and some of the things that people ask. Everyone will be muted. If you have to ask questions, just put your questions in the chat box. I do have some questions that people sent me ahead of time. And I will answer those questions first, and then we'll go to the chat box. Alrighty, so the basics on how to keep your family safe during this COVID-19 time. I'm going to go over in the next slide, the intention and the outcome. The intention is to keep all webinar participants informed on the COVID-19 science that will help you and your family stay safe during this pandemic. The outcome is that you will leave the webinar motivated to create an action plan for yourself and your family. And once you have an action plan created for yourself and your family, you will then be motivated to create an action plan for your broader community. I'm going to actually give people a moment to actually just read this quote. This is from the World Health Organization's Director General, Dr. Tedros. So I'm going to give you a moment just to read this quote. So I think it's important to realize that we actually can change the course of what we have going on currently. All right, so next slide. Okay, so what is a pandemic? A pandemic is a worldwide spread of a new disease. It must be an infection, it's contagious, and most people do not have immunity to it. Examples are smallpox, polio, tuberculosis, HIV, bird flu, which was H5N1, SARS, COVID-19 here is considered to be SARS-2, and also MERS. So why is it called COVID-19? Well, let's take a look at that. So the virus, the picture of the virus is over there to the right. You can go ahead and hit the slide forward. CO stands for corona because it looks like a crown or a halo around the virus. VI is next, that's for virus. D is for disease. 2019 is simply the year that the strain appeared, and hence why it's called COVID-19. So why is this so important? We've all experienced a pandemic before. If you're over 65, you may have experienced more than one. You may remember tuberculosis as well as HIV, and there's basically two final outcomes. One outcome is a complete cure or near complete cure. An example of that would be smallpox. Smallpox was eradicated from the world in 1980. Polio is a near complete cure. Or the second outcome is containment or management without a cure. So HIV is an example of containment or management, but with no cure. So let's talk specifically about coronavirus. So it's spread, as most people hear, through people and surfaces. It can spread from person to person by small droplets from the nose or mouth when someone infected coughs or exhales, or when these droplets land on surfaces, right? There's also a fecal oral route to the spread of coronavirus, but that is more of a major impact in areas that are less developed without proper sanitation. So I tell people to make sure to respect COVID-19. It's a droplet disease. It stays on surfaces for a very long time. It can stay on cardboard boxes for 24 hours. It can stay on plastic surfaces for 96 hours. So also consider looking or paying attention to high traffic surfaces. doorknobs, handles, debit cards, cash, gas station pumps, phones. For hospital workers, it's very important your shoes and your scrubs, which are things that can actually, you can bring COVID-19 home. So these surfaces you want to make sure to actually wipe or spray, etc., or have gloves on. Now, COVID-19 is highly contagious. Now, how is that calculated? So one way it's calculated is what is the minimum amount of time that someone has to be exposed to it in order to become infected. For COVID-19 is 45 seconds. Then there's also percent penetration, which is basically if 100 people were to come in contact with the disease, how many of them would actually get it? So with something like influenza, it's 20 or 30. With COVID-19, it's 60 to 80%. So that's what we mean by it being highly contagious. So let's talk about prevention measures. So we're going to talk about 3 categories: how to prevent getting it, how to prevent spreading it, and what happens if you or your family get COVID-19. So we've all seen on the news all the talk about hand washing. I use this slide because this is very important. Most of us wash our hands and we actually do number 1 and maybe number 2. We actually don't wash the back of our hands, the base of our thumbs, the fingers, the fingernails, the wrists. So proper hand washing really involves much more than what we normally do. And you remind people all the time when you wash your hands to actually wash it and use this as a sort of like 8-step hand washing for proper hand washing. Social distancing. Let's look at the power of social distancing. The way we were normally operating, one person would infect 2.5 people in 5 days, and they would infect 406 people in 30 days. If you do 50% less social exposure, then you have one person in 5 days that infects 1.25 people that then infect 15 people. 75% less exposure, which is where we are when we have the stay-at-home orders. You have one person that may infect 0.625 people and only 2.5 people in 30 days. So the social distancing has a dramatic impact on the spread. So in addition to hand washing and social distancing, I wanted to sort of go over what else you can actually do, right? And so what's really important is that, the CDC goes through a whole peer review process. So I'm going to actually give you some things that I call Dr. V's guidelines, which are a little bit more than what the CDC actually says. So number 1 is do not go to the grocery store. Think of it like the smallpox grocery store. You do not want to go to the grocery store. Order your food and your medication online. If there's elderly people that are on the computer that are family members, you can call them and walk them through how to do this on the computer. If you have elderly family members that are not on the computer, they can PayPal you or send you a check, and then you can actually order and have groceries sent to their address. When food or medicine or groceries are delivered to your house, there should be no contact with the delivery person, not even a handoff. It's very important. What I normally do is when they set it outside, I actually spray it with my Clorox, and then I actually bring it in after about an hour. When you bring whatever food or deliveries or groceries into your home, you should put it on the floor, not on a counter or a tabletop, because that is a surface that you touch and use a lot. If you're having cooked food delivered, then you want to actually transfer it quickly into your Tupperware containers and get it out of the plastic containers that it sometimes comes in. And then immediately throw away any paper, cardboard boxes from the delivery. Avoid using cash whenever possible. Wipe down your cards and your credit cards after use. And most importantly, do not get into small groups with extended family for holidays. I know that we have Easter coming up around the corner, and people may be tempted. I've been social distancing. My aunt and cousins have been social distancing. We'll just get together for a small dinner. I would not do that. One of the things that we found is that this disease actually presents itself in clusters where family members are giving it to each other. Now, a lot of you are missing your personal care services. I would not go to anyone's home to get your hair and nails done, and I would not allow anyone to come to your home and get your hair or nails done or a massage. It's just simply not worth it until we actually get through this. We're going to talk a little bit about risk factors. Who does well with this disease? Who does not do well with this disease? All right, so the risk factors for having severe COVID-19 is anyone that is 65 years or older. That is anyone that is born on or before 1955. Now, I have a lot of people who are older, who they work out at the gym, they may run marathons. They think that they're not old. The CDC guidelines and the research is bearing out that it really doesn't matter. If you're 65 or older, you do have a higher risk for having a severe illness. Also, people who live in nursing homes and long-term facilities. The other group is people with chronic lung disease, asthma, COPD, heart disease, those that are immunocompromised as far as either cancer treatment. One of the main risk factors that is not being talked about on the news is severe obesity at any age. So you can be young, old, or in between. If you have a BMI of 40 or more, you are at risk for not doing well with COVID-19. People who are pregnant should be monitored. They're known to actually be at risk for severe viral illnesses. However, the CDC has not actually listed it officially as a risk factor. So let's talk about the BMI over 40, because I want to actually go over specifically who does that actually apply to. So if you're 5'2" and you're greater than 220 pounds, 5'6" greater than 250, 5'10" greater than 280, or 6 feet greater than 300. Those are all the criteria there for a BMI over 40, over or equal to. Okay, men for some reason are at higher risk in getting the disease. And once they get the disease, they actually do poorly. So when you look at the COVID infection, about 58% of people who are infected are men and 42% are women. So about 20% more men get the disease than women. When you look at the death rate, about 1.7 women infected with COVID-19 die, whereas 2.8% of men infected with COVID-19 die. So they almost have a 30 or 40% increased death rate. Now, we don't know why, but one of the things that they have been looking at is facial hair, mustaches, beards, etc. They have specifically been in the healthcare setting, working in the hospital. They actually have advised a lot of the employees, if they have mustaches and beards, to actually cut them off. For me, my guideline is, I think it's a risk factor, and I would cut it off until this was actually over with. This is just shows some of the hairstyle, some of the problems with fitting a respirator with various types of facial hair that CDC actually put out. To wear a mask or not to wear a mask. All right, my guideline on this is I would wear a mask while I'm out. I'll go over a little bit more about why. I think that you will probably within the next week or two see the CDC come to the same conclusion. I would wear a mask when I am out. Let's talk about clinical outcomes. If you have one risk factor, the likelihood of you needing needing the ICU or a respirator or dying increased by 79%. If you have two risk factors, the likelihood of those things happen increased by 250%. So the risk factors are very, very important in clinical outcome in COVID-19. So those people who do have risk factors, they need to be even more careful about making sure that they do not catch this disease. Someone had asked me about are certain risk factors more important than others? Yes, cardiovascular disease by far actually has a worse outcome than compared with some other things like just hypertension. And those are the death rates by 1,000. Okay, all right, now, one of the questions that we had on the last was the difference between droplet disease and airborne disease. So I added this slide to actually go over it. So droplets are large droplets that hit mucous membranes. Airborne are small particles that are in the air, okay? Droplets are greater than 5 microns in diameter, whereas airborne are less than 5 microns in diameter, just the size of the molecule. Now, a droplet will fall short of 3 feet from its place of origin, where something airborne will actually can land much further. So what are some examples so you can kind of see the difference between them? So examples of droplet diseases are Ebola, pertussis, mumps, and COVID-19. Examples of an airborne disease is tuberculosis or measles. Okay, now we have a diagram to actually show this. Go ahead. All right, so, and I used the difference, I used here Ebola and measles, but it could be, rather than Ebola, that could be COVID-19. So it's kind of confusing when they actually talk about it on TV, because as you see, both of these, whether or not they're droplet or airborne, both of them are in the air. So it is transmitted in the air. The issue is about how far does it actually go from its place of origin, with the droplets going about 3 feet and the airborne, which can go much further depending upon what the size of the molecule is. Okay. So this is one of the reasons for this recommendation. People with asthma or people who have asthma patients that they're caring for in their home, or their children have asthma, they should not use their nebulizer machine, because that converts a droplet, if they're COVID-19 positive, to an airborne in the home. So it is very, very important. We are not using nebulizers in the emergency department. If someone comes in with an asthma attack, I will intubate them and put them on a ventilator before I will actually give them a nebulizer. We're not even using a nebulizer in the ICU. Okay, so I would not. Instead, what you can use is you can use an aero chamber or spacer, which is in the diagram here. And basically you use the inhaler, you use it like you normally would, 2 puffs. It goes into the little aero chamber area, and then the person actually breathes in and out. That will actually give them the same amount of medication as using a nebulizer. The other option is to take the nebulizer machine and the person's outside. But really, I would just not use a nebulizer. Okay, women who are pregnant. If you have a healthy pregnancy and you're actually, you know, going to near delivery around this time, I would consider home delivery with a midwife. So that way you're not going into an area that is possibly infected. Action plan. So let's go over some of the things for an action plan. So what happens if I think I have COVID-19? What are the symptoms? 1, there are no symptoms. You can have no symptoms and have COVID-19. And you can have no symptoms, have COVID-19, and transmit it to other people, right? So then the other thing is you can have a sudden loss of taste or smell. You can have GI symptoms, which are nausea, vomiting, and diarrhea. You also can have respiratory symptoms, which is what you primarily hear about on TV. So there's upper respiratory symptoms, which is a lot of headache, fever, achiness, fatigue, or lower respiratory symptoms, which is like more like a pneumonia, fever, dry cough, difficulty breathing. Social distancing versus quarantining. This is important. Okay, so, alrighty, yeah, keep on clicking. All right, so when you're social distancing, that is for everyone. Self-quarantining is for people who actually are COVID-19 positive or people who have symptoms such that they think they might be COVID-19 positive, because not everybody's able to get a test. So just based upon symptoms. Social distancing is staying 6 feet away from others. Self-quarantining is literally staying in your room in complete isolation. So people, you can have family members or someone bring you food, but you do not come out of your room. Social distancing we're doing for now. Self-quarantining, you have to do it for a minimum of 14 days. And this is important because some people will feel better after 3 or 4 days, but they still need to self-quarantine for 14 days, and preferably 21, because there's been some evidence that after 14 days, there are still some people who are positive and able to give it to other people. All righty, so the main thing with self-quarantining is that you really want to try to figure out, you know, what are all the things I need in that room for 14 days, and have all those things in the room. Preferably have a room where you have a bathroom. I have several people who have asked me with self-quarantine, well, can I just on the way home stop and get some food, or stop at takeout? Or you can't. It's straight home and then into a room that you're going to stay in for 14 days. Sorry about that. Okay. All right. Some people are kind of like, oh, well, you know, I'll just catch COVID-19 and get immunity. That's really not a good idea. COVID-19, because it's a lung disease, the infection sits in your lungs. It appears like ground glass, and it causes pulmonary scarring and fibrosis. So those people who get the viral pneumonia, there's a 50% death rate. As I said, the men do worse. And those people that survive, 30 to 40% of them afterwards have decreased lung volumes, and they have problems breathing with just normal walking. So it's not something that I would just get to get immunity. Plus, the immunity doesn't look like it's lifelong. It looks like it's for a period of time. How to win against COVID-19. Early detection and early response is the most important thing. So in our country, we're not doing the testing that we actually need to be doing. So, you know, right now, some of the early detection is just with your own symptomatology. Universal precautions are very, very important. They basically are, I assume I have COVID-19. I assume you have COVID-19. You assume you have COVID-19. And you assume I have COVID-19. And then everyone then acts accordingly, right? And so that is really the best way, because you cannot tell where it is or where it's not. So. All right, so let's talk about what's next. Forward thinking. I would start thinking now that if you had to be quarantined, where would you be in your home? Do you have the over-the-counter medications that you actually need? Do you have mask or mask alternatives? Whether or not someone actually started using coffee filters and they put a rubber band around it. How am I going to limit my exposure to highly trafficked surfaces? Am I going to keep the cleaners and the wipes in my car? Like, really, you want to start actually, you know, creating, you know, taking a couple of steps to create your world where you actually have the things that you actually need to attack this. Here's just the information about the Surgeon General and the CDC saying, no, don't wear a face mask in public. And, you know, if you're healthy, you don't need to wear a face mask. I think this will probably change within the week. I am wearing a face mask, and I am encouraging others to as well. How long for social distancing? Australia actually closed down for 6 months to stop COVID-19. So that will significantly impact a lot of people. You know, it's important that if you have a job that requires you, that is significantly impacted by this, that you may need to find something that you can actually do more remotely. A quick vaccine would be 12 to 18 months away. And that would be with things moving very quickly. They did start trials already in Seattle on people. The other thing was that, there was also something where the World Health Organization said to avoid ibuprofen, Aleve, naproxen, and that it would be better to take Tylenol. Then they later walked back that advice. I've been telling people I would just stick with Tylenol. I went out and bought some Tylenol products, and I would just stick with Tylenol at this point if I got sick. Do not go to the hospital unless you're really, really, really sick. There are patients in the emergency department with COVID-19. I wouldn't risk exposing myself to it unless, I really thought I was gonna, I really couldn't breathe, or I really thought there was something that was, I just had to go to the emergency department for. Aggressive testing guidelines, unfortunately, they vary state by state. Ideally, we would have more uniform testing that is sort of federally mandated. So some states have better access to testing than others. Stay alert, stay informed. I find that the best source of information, I believe, is actually the World Health Organization. And so as far as, for the public to access, and that's what I find actually kind of works the best. I just wanted to reiterate the importance of testing. This was a very interesting story. This is Wa, Italy. It's a very small town, about 3,000 people. They initially only tested the symptomatic patients. And when they did that, they were not able to eradicate COVID-19. Then what they did was they tested everyone. Once they tested everyone, they realized that about 15 to 20% of people were COVID-19 positive with no symptoms. So then what they did was the whole town self-quarantined for 14 days. And after they did that, they still had about 2% of the population that was still COVID positive and able to transmit the disease. And those people had to quarantine for an additional 7 days, which was a total of 21. But this town was then able to eradicate COVID-19. So if you already have a family member in the ICU or you need some help, that's all of my information. We're starting to put up, there's an experimental protocol that Duke University's put together. I'm going to actually get that on the website so people can kind of pull down information as they need it. Yeah, that's kind of, if you have a situation going on and you're wondering, different areas have different hospitals, and different areas have different expertise as far as this is concerned. Respect COVID-19 and create a plan for yourself and your family. All right, that is the end of the presentation. I just had, someone had asked me before about the impact of religion on pandemics. This was a question that came in. I actually, there's 3 examples. Smallpox in India. The Indian culture began to, or certain religions began to see someone as smallpox as actually being a blessing to your family. And that made it very difficult to eradicate. COVID-19 in Iran, there is a spiritual monument that people kiss or lick. That is why Iran became such a hot spot. I'm telling people now to keep their eye on Florida, because Florida has decided that essential services include going to church. So I think you're going to see a lot of people going to church in Florida over Easter. That's going to actually cause a problem there. All right, that's just the Twitter page, so you know what everything looks like. And we'll open it up for questions. All right, so put any questions in the chat box. While people are typing in the chat box, I'm gonna actually answer a couple questions that people actually sent in. So the first question was from Leanne about the New Orleans, and specifically that New Orleans is having a harder time with COVID-19, and that their death rate is higher, and it's actually 700% higher, so 7 times higher So she was asking, why is the death rate so much higher from COVID-19 in Louisiana as compared to New York? Louisiana, I don't know the answer, but I'm going to tell you what I would suspect. Louisiana has the highest obesity rate in the United States. It has the most number of people that per capita that are obese. So I would most likely assume that that you have more obese patients getting it than you have in New York, and that's leading to their increased mortality rate. All righty. Any other questions?
Are you ready for them, Velda?
Yes.
Okay, great. So I am just going to read first. Do you want me to read first names and not last, or just the question?
Yeah, just first names.
Okay, so this comes from Alicia. From what I understand, there are no delivery options available for groceries anymore because of the high demand. People who are now having to go out and get the groceries themselves, especially with Instacart and Amazon deliveries, persons going on strike. So I guess if you could speak to that, and I would add to that a lot of stores have senior hours. So is it smarter for someone that can go during senior hours to go, or what do you recommend?
Yeah, so I didn't know they had stopped. I actually, let me see, I'm trying to think, when did I last order groceries? I probably ordered groceries maybe about 4 days ago, and I was still able to get them delivered. So here's what when I did go to the grocery store, I'm going to tell you let me tell you what I did. One is I went when it first opened, because my thought is that, they stock the stores at night, and then there's nobody touching everything for hours. And so, whereas we're during the day, if I go to the store, I don't know, 2 o'clock in the afternoon, different people have touched all sorts of things throughout the store. So one is, I would always, if you have to go to the store, I would go first thing in the morning, right when it opens up. What was the other part of the question?
Well, if there's a senior in the house that can go during senior hours, which is first thing, is that recommended over somebody like myself who's older but would have to go later in the day?
Yeah, I'd recommend everybody go as early. I'm not sure about this whole senior hour, because I don't necessarily, I would go first. I would go first thing in the morning, whether or not I was a senior or not. I would go first thing in the morning. I'm not sure about the whole senior hour. And I'm not sure whether or not, now the other thing too I would do is I bought a freezer. So I bought a freezer and I loaded it up so that I don't have to go as frequently. And I noticed that when the last time I went to Trader Joe's, they were saying, please don't buy more than 2 of each item or something like that. But I did actually load up so that I don't have to go as frequently. But I haven't gone in almost a month.
Okay, great. So we have a couple more questions. And let's see. So this is from Teresa. How high does your temperature have to be concerned?
That's an interesting question. And that is also varying state by state. So I know that certain correctional facilities, if you're over like 99.6, then they're not allowing employees to come to work. So certainly at 100, that would be concerning. So there are different criteria depending upon if you're talking about like, should I go to work or not versus do I have it? Most people who have, one thing about this particular disease, COVID-19, is when you get it, you don't have a borderline fever. You have a fever. You have 101, 102 in general, right? Assuming you're not an asymptomatic patient. So most people are using a guideline of 99.6 to 100 before they stop people from coming to work.
Okay, thanks. There's another question about thermometers, and I'm just getting some clarity on that. Leanne, if you could just add some clarity around your question, and let me go to Dan's question for right now. Let's see. Okay, what are some effective disinfectants that people can use?
Oh, okay, this is a good one. So EPA on their website actually has a list of all of the disinfectants for COVID-19. And the list is probably about, I'd say there's probably 100 products on there. So what I'll do, that's a really good question, Dan. What I'm going to do is I will actually add that link to the website, because people got really stuck on Clorox, and you can get so many other things other than Clorox. There's like 100 other products you can get. And so when all the Clorox ran out, I just, went down that EPA link list and I ordered Santa Cloth, which is one of the other products on the list. So I will make sure that link gets actually on the website. But if you go to EPA.gov, there is a list of what they call sort of COVID products that kill COVID-19.
On that note, Valda, if you could speak to, I actually was online and noticed I can't get hand sanitizer anywhere, and I have just a tiny bit left. What do we recommend if you have to go out and you don't have any hand sanitizer? What's the next best thing?
Gloves.
Okay, great.
Yep.
Okay. The next question comes from Ronald. I'm still waiting. Leanne, if you could there's a question about, do people have an oral thermometer? So I guess that's where I'm not sure what else on that question. If you want to speak to thermometers.
Yeah, so now they have the thermometers that are oral. They have the ones where you can kind of put them on your forehead. Any thermometer would work or be fine.
Okay, so we have a few more questions in here. I didn't see them. Okay, so Ronald's asking, or is mentioning, that Whole Foods does have hours for people 60 and older from 8 to 9. There are also some stores that are allowing healthcare personnel in the store only at the end of the day, as a comment to add in.
Okay.
And then Leanne was saying that wanted to just remind people to be sure their family and friends and neighbors have an oral thermometer. Thanks, Leanne.
Yes. Okay.
Alicia has a comment or a question here. Today, the National Academy of Science informed the White House that the research is consistent with the aerosolization of COVID-19 from normal breathing and bioaerosols in normal conversation and exhalation.
Mm-hmm.
How does this change anything?
Well, so basically what they're saying is that, it's not just coughing and breathing, it can also occur with normal speaking, right? But because the virus is still greater than 5 microns, it's not going to go further than that 3 feet, right? So that 3 feet rule is still good. But I think they're going to recommend masks, which I think they should have done from the beginning, right? So to me, I think masks are going to be something that they're going to tell healthy people to wear masks when they're actually going out.
And I know you spoke about it in the PowerPoint. What are the other things people can do if they can't find masks? I did see online that there were some masks available from Amazon, like surgical ones, but I know they're recommending to keep those they don't arrive until like May or June.
Yeah.
But it's recommended to leave those for the healthcare providers.
Yeah, so it doesn't have to be an N95 mask. It can be a scarf, it can be a bandana, some things that people have for their hair they can put around. I had a little cap that I used to play tennis in that kind of has a material around it. I pulled that down around. So it's anything that kind of covers your face, your nose, but it has to specifically cover your mouth and your nose.
Okay, great. And one other question, if you could speak to people who may be experiencing some high anxiety and how to stay informed without, causing panic attacks, or what's the best advice around, maybe also adding to that, if you are recommending quarantine, what's a way that you can keep your mental health if you can't go on walks for 14 days?
Yeah. Okay, so a couple things, because during 9/11, I almost caused a panic attack for myself, right? And so I know one of the things that is really, really important sometimes, if it's anxiety provoking, is to actually read your news rather than watch the news, right? And so and read it like once a day. Don't read it over and over and over again, right? The other thing that is important for people is to actually create a time in your day where you're going to actually do something that is completely different and enjoyable for yourself. Whether or not it's watch a comedy or whether or not it's listening to an ebook, but you really have to kind of create some time that is not about work, not about the news, and something that's just really enjoyable for yourself, right? And so that is really important. But for most people, I tell them turn off the news, the visual, the TV is not your friend during this time if you're constantly watching the news.
Okay, great. I think there might be one more question on here. I have made from Dan. I have made a homemade mask with a baseball cap and plastic report cover taped to it. I'm wearing it now. Oh, if if there was a way to get on video, Dan was willing to show it to the participants. But
Oh,
he's
that would
made
be
a
great. I don't know if there is a way,
So
but
Dan, if you hover, I don't know if this will work, but if you hover over the bottom, there's a start video feature, and you may be able to start your video that way, and we may be able to see it. Okay, so while we're waiting for Dan, the question from Vince: how often do you sanitize or wash your mask? That's a great question. And I guess I would add to that, how would you recommend people doing it?
yeah. So one is the virus is pretty easy to kill because it's got kind of like a fat covering. So almost any detergent will work. It does seem to be a little bit more heat sensitive. So I normally do either wash it on either like a warm or a hot cycle. And so I have been washing my mask about like every other day. I'll wear one and then I'll wear another one and then I'll throw them both in the washing machine. This is when I'm not at the hospital. I want to just be, because at the hospital, I actually, we have disposable ones.
So I don't see any questions at this time, or just, I asked Dan if he was able to get the video, I don't know. And just, we're at about 9 minutes to the end of the hour.
All righty. All right. Well, I want to thank everybody for coming on to the webinar. And if you think of anything, feel free to join us next Tuesday. All right. Thank you.